Community College student nurse, and today I'll be doing IV push competency. I have a Miss Green for Dr. Moore who ordered furosemide 30 milligrams IV push Q8 hours. So at this time, I'm going to compare my Moore and my order together. And we have Miss Janet Green. Date of birth will be 6/3/1972, and she is allergic to penicillin. They have her in room 418. Okay, Dr. Moore ordered furosemide for her edema, 30 milligrams IV push, 30 milligrams IV push, Q8 hours. So the order does match my Moore. Okay, with furosemide, the usual dose, safe dose, is 20 to 40 milligrams. She will be getting 30 milligrams per order, and it is a safe dose. It can be undiluted, given or diluted. I'm gonna do undiluted because she's getting it for edema, so she's gonna get it undiluted. I have D5 hanging, so it is compatible with furosemide. My rate of emission will be 40 milligrams or a fraction. Can be given over 1 to 2 minutes. So I'm giving 30 milligrams, which is within that range. Also, I'll be monitoring, it's a potassium, a loop diuretic, so it'll be pulling some fluid off Miss Green. So I'll be really monitoring her electrolytes, getting her vital signs. Patient teaching that I'll be doing, it will cause hypotension, some dizziness, so I make sure that I tell her if she needs some assistance to just make sure she have a call bell and to let the staff know if she needs some assistance. And at this time, I have my medication, and it comes in about 40 milligrams per 4 milliliters. So I'm giving 30 milligrams. I did do my math, and it's going to be 3 milliliters to 1 to 2, given at the rate of 1 to 2 minutes, over the rate of 1 to 2 minutes. Also, is no expiration. The expiration is 1 May 2020, so it is not expired. Clean up. I'm going to clean for 15 seconds. And pull up my 3 milliliters. Push my air in. Okay, I'll be inspecting to make sure I don't have any air bubbles. And I do not. 3 milliliters. Recap. Okay, and I real label. Patient is Ms. Janet Green. Drug is furosemide. Amount is 30 milligrams for 3 milliliters. Prepared date is 2/5/2020 at 4:49 p.m. Prepared by Victoria Harris. Expiration date. So I label my syringe. Hi, Miss Green. How you doing? My name is Victoria Harris. I'm a student nurse from Harris Community College, and today I have an IV push that I need to do for you per doctor's order. But first, I'm going to get you identify. And also, yeah. Okay, can you do your name and date of birth for me? Okay, she said her name is Janet Green, date of birth 6/3/1972. Are you allergic to anything? She said she's allergic to penicillin. So at this time, lower my bag. Make sure I have any blood return. I do have blood return. I'm looking for any infiltration, warmness, everything is fine. No infiltration, no warmness noted. Okay, Miss Green, so you're getting furosemide 30 milligrams by IV push. Dr. Moore ordered to get some of your edema off. One thing that it will have you probably going to the restroom because it takes the fluid off you. So if you need any assistance, just let me know, or any staff, so we can assist you. We're gonna put your call bell. Make sure your call bell is in reach, so when you need assistance, you can just use your call bell. And I'm just gonna use this one more time to identify Janet Green. So it's not an INT. If it was an INT, I would definitely use gloves. So I'm going to shrug my hood for 15 seconds. And I give it slowly, but I'm going to give 1 and 1/2 over the period of 1 to 2 minutes. I'm going to do it slowly because if she don't want to damage her ears, her eardrum, it does cause ear damage. Okay, put that over there. Alright, I'm going to connect. Alright, I'm going to start on pinch and give my 1 and 1/2 over 30 seconds. Alright, I'm going to hold, release, and let the primary flow through for 30 seconds. I'm also monitoring my patient for any discomfort, making sure that she's tolerating it well, and at this time she is tolerating it well, so I can continue for the next minute, which I will administer at 30 seconds and release for 30 seconds. Alright, I will pinch off and administer 1 and 1/2 over 30 seconds. Okay, I release my primary fluid, going and constantly making sure that my patient is fine and tolerating. At this time, letting my primary fluids flow through for 30 seconds. Constantly monitoring my patient at this time, making sure no discomfort going on with her, and it's no discomfort. So she did tolerate furosemide 30 milligrams well. Alright, that's 30 seconds. Everything she has tolerated well. Like I will do some reteaching, making sure if she feel any dizziness while getting up, to make sure she use her call bell. So her call bell will be in reach. Bed lowest position, size rails up time soon. And this ends my competency.